Access to healthcare is not a privilege. It's a fundamental human right. This right is essential for the well-being of individuals and the overall health of communities. Without access to healthcare, people are left vulnerable to diseases, unable to manage chronic conditions, and at risk of preventable deaths. It's the cornerstone of a just and equitable society. When healthcare is accessible to all, it ensures that everyone, regardless of their background or circumstances, has the opportunity to live a healthy and fulfilling life. This access promotes social stability and economic growth, as healthy individuals are more productive and can contribute more effectively to their communities. When people can access timely and quality healthcare, it fosters healthier individuals, stronger families, and more resilient communities. Preventive care, early diagnosis, and effective treatment are all critical components of a robust healthcare system. These elements work together to reduce the burden of disease, lower healthcare costs, and improve the quality of life for everyone. Good health, after all, is essential for individuals to thrive and contribute fully to society. It enables children to attend school regularly and perform well academically. It allows adults to work and support their families. It ensures that the elderly can enjoy their later years with dignity and independence. In essence, good health is the foundation upon which we build our lives. However, the reality is that millions face significant barriers in accessing this fundamental right. These barriers can be physical, such as living in remote or underserved areas where healthcare facilities are scarce. They can also be financial, with the high cost of medical care putting it out of reach for many people. These barriers are multifaceted, ranging from geographical remoteness to financial constraints and systemic inequities. In many parts of the world, healthcare infrastructure is inadequate, and there is a shortage of trained healthcare professionals. Additionally, social determinants of health, such as education, income, and housing, play a significant role in determining access to healthcare. Understanding these barriers and their impact is crucial for crafting effective solutions. By identifying the root causes of healthcare disparities, we can develop targeted interventions that address the specific needs of different populations. This requires collaboration between governments, healthcare providers, and communities to create policies and programs that promote health equity. Our zip code should not determine our health destiny. Everyone, regardless of where they live, should have access to the same high-quality healthcare services. This means investing in healthcare infrastructure in underserved areas, training and retaining healthcare professionals, and ensuring that healthcare services are affordable and accessible to all. Nor should our financial status dictate our access to life-saving treatments. No one should have to choose between paying for healthcare and other basic necessities like food and housing. Financial barriers to healthcare can be addressed through policies that provide universal health coverage, subsidize medical costs for low-income individuals, and regulate the pricing of essential medications and treatments. The pursuit of health equity requires a collective effort to dismantle these barriers and ensure everyone has a fair chance at a healthy life. This involves not only improving access to healthcare, but also addressing the broader social determinants of health. By working together, we can create a world where everyone has the opportunity to achieve their full health potential and live a life of dignity and well-being. Geography plays a significant role in shaping healthcare access. The physical location of a community can determine the ease or difficulty with which its residents can obtain medical services. In rural and remote areas, this issue is particularly pronounced. For those in rural and remote areas, the nearest hospital or clinic might be miles away. This distance isn't just a minor inconvenience, it can be a matter of life and death, especially in emergencies where every second counts. This distance translates into significant challenges, particularly in emergency situations. When an emergency arises, the time it takes for an ambulance to reach a patient and then transport them to a healthcare facility can be critically long. Transportation becomes a major barrier. In urban areas, public transportation systems are more developed, offering multiple options for getting to a hospital or clinic. However, in rural areas, these options are sparse or non-existent. Public transportation options are often limited in these areas, forcing individuals to rely on personal vehicles, which they may not own or afford. This lack of reliable transportation can mean missed appointments, delayed treatments, and worsening health conditions. The lack of accessible and reliable transportation options can delay timely care, exacerbating health outcomes. For instance, a missed bus or a delayed ambulance can mean the difference between a manageable condition and a severe health crisis. Moreover, rural areas often grapple with a shortage of healthcare professionals. Clinics and hospitals in these regions may have fewer doctors, nurses, and specialists, leading to longer wait times and limited access to specialized care. Attracting and retaining doctors, nurses, and specialists in these regions can be difficult due to factors like professional isolation and limited career advancement opportunities. Many healthcare professionals prefer to work in urban areas where they have access to better resources, professional networks, and opportunities for continuing education. This shortage further exacerbates the challenges of accessing timely and specialized care for rural communities. Patients may have to wait longer for appointments, travel further for specialized treatments, and may not receive the same level of care as those in urban areas. The combination of these factors creates a significant disparity in healthcare access and outcomes between rural and urban populations. The cost of healthcare is a significant barrier for many, even in countries with universal healthcare systems. Despite the promise of accessible care for all, financial obstacles remain a daunting challenge for countless individuals and families. The reality is that healthcare expenses can quickly accumulate, creating a heavy burden that is difficult to manage. High deductibles, co-payments, and out-of-pocket expenses can deter individuals from seeking necessary medical attention. These costs can be particularly overwhelming for those with chronic conditions requiring ongoing treatment. Even routine checkups and preventive care can become financially out of reach, leading to a cycle of neglect and worsening health. The fear of incurring substantial medical debt often forces people to delay or forego essential treatments. This hesitation is not just about immediate costs, but also the long-term financial implications. Medical debt can have a ripple effect, impacting credit scores, housing stability, and overall financial security. For individuals and families living paycheck to paycheck, the choice between putting food on the table and seeking medical care becomes a harsh reality. This dilemma is a stark reminder of the inequities within our healthcare system. When faced with limited resources, many are forced to prioritize basic necessities over their health, leading to dire consequences. This financial strain can lead to the postponement of preventive screenings, management of chronic conditions, and timely treatment of acute illnesses. The lack of early intervention can result in more severe health issues down the line, which are often more difficult and expensive to treat. The consequences of delaying care due to financial constraints are significant. Not only does it affect the individual's health, but it also has broader implications for public health. Delayed care can lead to the spread of infectious diseases, increased emergency room visits, and higher overall healthcare costs. What might have been a manageable health concern can escalate into a more complex and costly medical issue. Early detection and treatment are crucial for effective healthcare, but financial barriers often prevent this from happening. As a result, patients may find themselves dealing with advanced illnesses that require more intensive and expensive interventions. This cycle of delayed care not only impacts individual health outcomes, but also places a greater burden on the healthcare system in the long run. Overcrowded emergency rooms and overworked healthcare professionals are just some of the symptoms of a system strained by financial barriers. Addressing these issues requires a comprehensive approach that includes policy changes, increased funding for healthcare programs, and greater support for those in need.